Thank you.
Thank you. Good evening and good morning to some of the participants that is stationed abroad. Good evening here for all the participants in the US. I think everybody kind of hear my name. Just to introduce myself, my name is ARVIN BUCOL. I was born and raised in the Philippines, and I moved here when I was like 30 plus years of age. Basically, my professional background, I have bachelor's in arts. I have master's in arts, and at the same time, I went also to nursing school. So I have a degree in Bachelor of Science in Nursing. What I do at the hospital basically is that I am in charge for performance improvement, quality assurance, and I am also the patient safety officer for 2 hospitals here in California, which is Montclair Hospital and Chino Valley Hospital. The overall goal that I do in my department as a day-to-day basis and as an ongoing thing is that we ensure to maintain the highest and achievable quality of care that we provide to all our patients at the same time by reducing or minimizing the patient harm. So in my job, I basically do a lot of oversights, a lot of meetings, a lot of collaborations with every department directors. I am in charge with the hospital organization preparation for our Joint Commission. I make sure that our policies and procedures are up to date, providing some support and up to a point where we give education to our staff, and not only our staff, but at the same time to department directors, and share this with our leadership and also our physicians provider. One thing that we do in my department is we ensure that we have the hospital-wide performance improvement indicators or data collection. So what we do with the data is that we have a very good systematic process where we develop internally indicators for high risk or any areas where we identified to be a problem area. We collect those information. That is one of the requirement for hospital based on the requirement from CDPH to have a quality indicator program in the hospital. So we present those information with analysis to leadership. At the same time, we present it also to the executive committee and up to the governing board of the hospital. One thing that I do also is that we ensure that we are in compliance with Department of Health, which that is the one that provides us with the regulations. At the same time, we are making sure that the hospital is also compliant with the regulations with our accrediting body, which is, I mentioned, the Joint Commission program. I serve also as the patient safety officer of the hospital. There are some initiatives that we do that we have to ensure that we promote safety, not just for our patient, but at the same time for our staff. We review internal policies and procedures for our hospital. At the same time, I also serve as a support for risk management department. The department is the one that making sure that any incident in the hospitals are taken good care, or anything that are incident reported are provided with any actions. So we do also root cause analysis intensive case analysis, and I provide also some feedback for physicians' peer review or leveling if in case there is an incident that is reported against the physician. Mainly, the model that we use for my department is the PDCA, which is very basic that we do. We follow the recommendation from CMS, which is the Plan, Do, Check Act. Mainly, it's proposing a change in a process if something is not working. Implementing change if needed. At the same time, we're just measuring the results of what we do to make sure that whatever actions we take, we see an improvement in those initiatives that we do. I think the main thing that I basically do in my department, which I think I can work with, and probably one of the areas that are very, very excited, that I am excited to focus into, is probably the what we call how we minimize patient harm in our hospital by making sure that the quality of care and maintaining our compliance with regulations here in the US with all the accrediting body and with the Department of Health. On behalf of that one as well, I'd like to thank everybody for giving me this opportunity. When this was presented to me by Samantha, I was excited to learn new things. You know, as I said, I've learned a traditional or what we call the normal concept of learning. You go to school, you do your assignments, you listen to your professor. I think the concept really gives me an interest to learn a kind of a holistic approach in learning. And I'm excited to know more. At the same time, I'm excited what I can offer more in the field that I'm trying to pursue at the moment. So basically, I would like to just broaden my experience and my understanding. At the same time, I just want to grow and learn more and enhance my professional prospects. Basically, that's it. That's for me. I don't know if you have any more questions or anything that you need to clarify for me. I'm willing to take that chance, the opportunity.
Okay. What the topic? Do you think the topic that you would like to propose?
ARVIN, do you have your topic in mind?
In mind, right?
I think the topic in my mind is probably I want to see reducing harm in workplace, especially on making sure that patients are safe, you know, and we provide the highest quality of care. Mainly, that's one of the topic. There are some few approach that we have already done in the past, and I think I'd like to explore that part.
The topic must to start with the word model of, right? And
Patient safety.
Yeah, model of your success work, right?
Yes.
Yeah.
ARVIN, it can be model of quality of care correlated to patient safety. If you want to bring patient safety to be, you know, the first one, so it will be model of quality of care related to patient safety.
Okay, or Professor?
We have some
Yes.
some points. I would like to the presentation ARVIN do very well, and then very the data is all right. But I think it seemed like the situation, the professional is not nurse really, but it's related to the management of the situation in your hospital. And as you say, you follow the indicators, the regulation of the state university. That is the activities you can add it into your writing, because you have to present your background work and how it works, how department control all the topic or the activities within that. In fact, your field not exactly related to the curing, but it's related to the management of activities within that department. That's my point of view. You may mention about how to follow the indicators setting up by the state of the that's it, and how to provide some safety for the patients within your responsibility. That's it, I think. And then do the cooperation with another department. I think that is the activities you have to mention with your writing, or the topics should be like that. Alan, yes, thank you.
I have heard you from your propose about the topic. I cut the words. The word is a harm. The second word is to calm down. Something like that. So something like that. Harm and calm down. And then the third one, I think that it means how it means like you are like the pre-consult to the patient before consult, that to go to the for the patient to be healed, to be cured by the special treatment from many special doctor inside, something like that. I'm not sure I talk this right or wrong, Dr. ARVIN.
Let me just, I think, go back a little bit. The quality department is kind of like in charge mainly with the quality of care at the same time. We provide support, and I understand that nursing is more on the patient care part, but the approach on the quality of care, sometimes we collaborate with them. We provide them with things that we do. Looking at all of the information that you provided, one of the information that really triggers me was because it was like more on the activities in the management. I'm not sure if something to do with regulation and how hospitals are able to like pass surveys and stuff like that, if that is something that I can do also.
Yes, you can. Yeah.
Because I think I can do more on the management part. I can do any of this. All of these models are really, really essential. They're really, really good topics. It's doable. It's workable. There's a few areas that also it gives me an interest. But if these two are the main thing that you can agree with me, I'll take it. Like the model of care related to patient safety, I can work on that one.
No, ARVIN, you don't have to accept it though, because it's just for an idea, but if you have your own, just come up with something that you really want to do and then present it to Dr. Sak, and then he will see and then approve, and then you can get started.
Okay.
I just give you an idea. It's not certainly that you have to accept it.
I think that I would like your maybe later after talking the topic. Yeah. But the one thing that I think that you try to talk to tell the people that it's about the safety care for the patient. The second is the management, the regulation, the management. Very good. It is a how to. It is tell the how to make this safety patch or patient to be healed. The fourth one, I think I heard from you, the holistic, very good word for it. It is something that I catch from your words. Anyway, you can arrange the model of, like Dr. Alisa say something that maybe you make it more objectively, directing to your mind that you want to tell us. That is very, very crucial things that the operator or the working at hospital area have to pay attention, something like that. Something like that. Okay, I think that I catch many words from you. You can be arranging the topic that is more practical, more efficient, and make the safety for the patient. Thank you.
ARVIN,
Yeah.
your job, it look like you are the quality control or the operation manager, right?
Yes.
You have to check the quality of insurance. You have to cooperate with the government regulation, and you have to do by the hospital regulations and control all the nurse and how they work, and have to teach them to work. That means look like the operation manager of your job, right? When you offer your proposal, just try to do the best on the first thing, because the proposal is very important thing. The first part of writing. So the second part, you can do what is your job. So try to explain like an expert, not to copy from another. Then your own. You are the expert person. That the Bodhisastra need that thing from you. That your idea, your experience. You are the expert person. You're not the copy from another person. So your thesis must be the best. So everyone can learn from you, not you learn from them. You are already the expert person already. So that's the way it is. Thank you very much.
ARVIN, what is your model now? What's the name of the topic or the model that you have it in mind?
Since I am in the management, the quality of care is something that we look into. We manage it. We have some hard stop data information. We develop some tracking information on that one. I like the patient safety collaborated to the quality of care, because mainly our goal is that we don't want any harm to our patients when they come in. So I think the management part and how to manage patient safety is what I wanted to do. I have done this in the past. I've been doing it currently, and we have some initiatives already that it's not copied from any other institution. We are practicing different approach to ensure that patient safety is one of our highest priority. I understand that all over the world, we have more than all over the nations in the US, we have more than 10,000 hospitals. One of the main issues that we always face and challenges that we have is the safety of our patients. And I think I am challenged to do this. I would like to go with the quality of care that is relevant to patient safety.
I think that's that I very interested in ARVIN topic about the regulation, about management for the safety of the patient. It is rather like a very about management and data analysis, very important for that. And I think that the model should be have the picture of management and the regulation to manage something like that. I think that if I work in the aviation field before, so any section of aviation had to learn human factor, something like that. It concentrates to the risk procedure, about the procedure to system there to make very important for the all aviation company have to have to learn human factor, something like that. I think that in the same as you as ARVIN would like to tell something that about the harmful, like the risk, something like that. So for make quality for the patient. I think that very interesting for me. Thank you.
Well,
Before we done.
Before I say thank you to everyone, I'd like to thank Sam for introducing me to this opportunity. I'd like to let everybody know, I'm very excited with the model or the concept of education that was presented. I'm very impressed with the idea that yes, the traditional learning is more on Google and all of that four corners of the room, and we are switching to the AI program. And I think this model is really based on experience, and experience is the best teacher. And I agree with that one. So BOU, thank you so much for the opportunity that you have provided to me.